will feel shame if they're
Yeah.
seeking assistance, and even not just medication but CBT. Oh, I'm not crazy.
Yeah.
I don't need to go there.
I
I
don't need
don't,
to talk to
but
someone, right? Like I don't need to talk to, we're social beings. We need to talk to people, right?
mm-hmm.
And and it doesn't have to be a therapist. It can be a good friend. It can be anyone. If you don't want to talk to people, do something that connects you again with your body. Because when we go through, especially like things like trauma or mental health issues, we get disconnected, and there's a lot of research that shows talks about how the first thing we do is just get connected. So your body and you're not connected with your body. And I think a lot of focus, especially in therapy, is to how do you reintegrate your body with you as a person, right? Your ego. So
It's
there's
true.
something around those
It's in
pieces.
tandem, the mind and body.
Yeah,
It's
yeah,
both.
yeah,
People forget
100%.
that.
Yeah,
So and I remember we touched upon this in our IG live as well, where physical health and the physical body is revered, and that's okay to take care of. But your
yeah,
mental health is crippled because you're not allowed to engage with it the same way as you would with any physical ailments, right?
yeah,
It's
yeah,
terrible,
yeah,
but
yeah.
that's why with more conversations and more awareness, it's gotten a lot better.
It's
That
better.
can't be
Yeah,
denied.
yeah. And if you read books from what is it, what's the name? From Vancouver, the physician, like Peter Levine, Gomez, I forgot. He's a very famous. So there's a lot of people like Peter Levine and Jennifer Fisher and all those people talk a lot about how physical illness, not everything. I want to make sure. I don't want the audience to say, "Oh my God, this is." But a lot of physical illness the root could be emotional blockage, right? There's a
Yeah,
lot of
it's true.
studies that are showing, especially like fibromyalgia and all those things, arthritis. I'm not saying put all, but a lot could possibly stem from a lot of. I didn't take care of my emotional needs when I was young or later on. I blocked it up. I kind of bandaged it up. Now it's coming
Mhm.
through my body because your body needs to express this pain it has. And
Well, I can
hence,
actually
ego.
share something about that.
Yeah.
Um, so there is, as you mentioned earlier, about a baseline, right? So we actually have a genetic disposition for how much of a baseline we're going to have. So,
Okay.
and this also goes with resiliency.
Mm.
And so what happens there is, if it's there's even been studies, if you are, let's say, for example, depressed people or people who are sad will feel more physical pain than someone who is happy. It's like, think
Yeah.
of it this way in your life. It's just at some point, think about a time you were hurt. If you're
Yeah.
focusing on the pain, I fell on my elbow, for example, and I'm
Yeah.
focusing on my elbow. What am I doing? You
Exactly.
know, I'm just focusing on that, and it's causing that pain. So
Yeah.
they're trying to, and not trying to, they've proven it that a lot of times, especially
Yeah.
with some kind of chronic pain, and so there could be, like you were saying, a more underlying factor to it that could be
Yeah.
taken
Yeah.
care
Yeah.
of, and then that pain
For
will be
sure.
helped.
So the book I was talking to you about, When the Body Says No,
Hmm.
by Dr. Gabi Mate. He's a physician, Vancouver physician. He has dealt with a lot of people, homeless people who had drug issues, and he had gone through his own journey. It's amazing some of the evidence he's talking about, right? And there's a lot now. I think we're moving towards why is physical illness so apparent nowadays, because we think it's a lot of unresolved emotional trauma that we dealt with, right? So interesting to know.
It is. And I mean, like I said, as more years pass by and more awareness is brought to it, we're going to understand that the health of someone is both mind and body and
Yeah,
social. Well, social health as well. Sorry,
yeah, yeah,
I
for
forgot
sure.
that.
Yeah, yeah, yeah.
So I'm wondering though, considering all this that we've talked about, now going back to when your struggles with generalized anxiety,
Mhm.
I'm wondering, was that a motivator for you to get into your line of work?
No, I can lie and
Really?
tell you a huge story about it. No, I wanted to be a teacher.
Whoa. Yeah, I want to
Um,
hear it. Let's go.
yeah, I wanted to be a teacher because I wanted to be a teacher. But when I got after my teaching degree, I always struggled with anxiety, but it wasn't a big thing. I'm like, whatever. Because obviously in my family, we don't talk about the struggles of anxiety. It's just like you deal with life. Like you don't like, oh, let's get help. no, you just do it.
Let's do
So,
it.
so that's
Yes.
how. So as a teacher, once I finished, I tried to get a job at the TDFB, and I couldn't. It was really, really difficult. So I actually started working for CanTED, which is Canadian Tamil Youth Development Center. It's a youth organization
Okay.
for Tamil young people, right? I just wanted a job. I didn't care.
I think many people will relate to you on that.
Yeah,
No
and
problem.
I was actually a teacher for like a short time in a private school, but it was really far. I'm like, I couldn't do it. So
Mhm.
so mind you, a little synopsis. So when I was doing the private school, I kid you not, I was so anxious that I actually started throwing up. I didn't know why. When I did my teacher's college, I did like 12 courses a year. I did everything. But when I had to teach, I was so physically sick. Like for me, when I get so anxious, I get physically sick. Like literally, I get like breakout, right? And in for me, that's like it's a blessing in disguise because even though I might not feel anxious, when my body breaks out, I'm like, oh, okay, Kavita, like there's something else going on. So now I actually take it with I'm so grateful that my body does break out when I'm in denial about my own anxiety.
Well, I guess in a way, because you're saying it's at least communicating with you.
Yeah, exactly.
Yeah,
Right.
I
For me,
see.
that's a perspective, right? Like some people are like, oh my God, I'm taking it as a positive thing. Just on a side note, I want to let you guys know this. So anyway, when I was teaching, I was so sick, and I like my parents are supportive and everyone's supportive. They're like, are you sure you want to do this? Like you're getting sick, you're anxious, you don't want to talk to people, you're like very like so go even then I didn't know it was anxiety in the term anxiety that I know now. I just thought maybe it's a lot of pressure. I put so many different labels, but the word anxiety.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca where you can donate and spread youth mental health awareness.
YouthSpeak Performance Charity. Speak, inspire, change.